What do Donald Trump, RFK Jr., J.D. Vance, and Dr. Oz have in common? They blatantly lied about how they're cutting Medicaid and kicking Americans off their health care. Here's Donald Trump.
We will take care of Medicare, Medicaid, Social Security. We will take care of everything.
Here's RFK Jr.
We're not cutting Medicaid. There's no cuts to Medicaid.
And here's Dr. Oz.
Well, in every program that I've looked at, every model on Medicaid, we're actually spending more, not less. We're spending more money on Medicaid.
And last, but certainly not least, here's J.D. Vance calling Medicaid cuts minutia. Today, on the 60th anniversary of Medicaid and Medicare being signed into law, we're exposing the Trump administration's lies and setting the record straight about how they are actually cutting Medicaid. I'm Hannah Moldavan, Deputy Communications Director for the Democrats, and your host for today. It's Wednesday, July 30th, and this is the Democrats' Daily Blueprint. For weeks now, we've been talking about how the Republican budget bill, their one big, beautiful bill, cuts healthcare for 17 million Americans. That's not our opinion. It's not commentary. It's a fact. Republicans cut Medicaid by $1 trillion in this bill so they can shovel additional tax giveaways to ultra-wealthy Americans who don't need it. There's even a direct line between how much they cut to healthcare and food assistance and how much they're giving away. Let's look at this simple chart. You can clearly see how Republicans lined up deep cuts to healthcare and food assistance so they could lower the tax burden on people who make over $500,000 a year. It's a reverse Robin Hood. They're literally taking away from the poor and giving to the rich. But what do these cuts mean for Americans who rely on Medicaid, especially those who may not know they're on Medicaid since it's called something different in every state? Here's a local hospital in Louisiana explaining what Medicaid means for their community.
We run our clinic 12 hours a day, Monday through Friday, and a half a day on Saturday, because not every person has a job that allows them the opportunity to go to appointments during the day. Well, so we are there so they can come before work or after work to get their primary care in a setting that's appropriate for that. Otherwise, they would either forego that care or they would wind up in the emergency department.
These cuts would be devastating. And that's why for today's episode, on the 60th anniversary of President Lyndon B. Johnson signing Medicaid and Medicare into law, we wanted to dig into this essential program and talk about how it makes a difference for millions of Americans. So first, let's talk about what Medicaid is. It's health insurance for people who don't make enough money to afford health care on their own. Medicaid covers Americans going through tough times and those who need a little bit of a helping hand. It covers children and seniors, as well as Americans with disabilities and those with complex health challenges. Without health insurance, many of these individuals would be forced to rely on hospital emergency rooms to get care, because that's a place they can go that can't turn away anyone for not having health insurance. In many cases, these Americans could go broke just because they got sick, especially since uninsured Americans are twice as likely to say that they struggle to pay for medical care as those who are covered. Medicaid fills in the gaps of coverage and helps more people go to the doctor. And studies have shown that Americans with insurance are healthier because they don't have to avoid doctor visits over financial worries. They can catch those chronic illnesses sooner and get the treatment they need before they get sick. So if Medicaid helps people get coverage and helps them go to the doctor more often and helps them stay healthier, then we should all be supportive of Medicaid, right? Right? Well, Democrats have been advocating for Medicaid for decades. We're the party of more people getting more care and being able to lead healthier, more fulfilling lives. It's like former Minnesota Senator Paul Wellstone, who's a mentor of the DNC chair Ken Martin, once said, "We all do better when we all do better." And that's why Democrats included Medicaid expansion as a core pillar of the Affordable Care Act, which has helped nearly 50 million Americans get coverage. But Republicans, they fought against Medicaid tooth and nail since it was first passed. They don't care that Medicaid recipients need it to survive.
There's no frills here. No one's taking advantage of anything. They're trying to survive.
They don't care that pregnant women might have to travel 60 miles or more to receive care.
Inside a maternity ward in Clinton, Missouri, Dr. Jennifer Blair worries for her patients.
Missouri has the fourth largest number of maternity care deserts. We actually are surrounded by several maternity care deserts. That's defined as a county that has no or very limited access to obstetric services for their patients. If we were to lose that access, the birthing center here at Golden Valley, our patients would have to travel more than 60 miles to receive those services.
They don't care that a mother of a 9-year-old girl with brain damage and cerebral palsy is afraid of losing her daughter, all because of red tape.
What do you worry the most about what could come out of this bill being debated in this new budget? Is it the
I worry about
cutting finances or more red tape, or what do you worry about the most?
I'm worried that the red tape is going to affect our Medicaid because of just the oversight burdens, and that as a result, I'm going to lose my daughter.
And they don't care that children who rely on Medicaid won't be able to get the care they need.
They're trying to slash Medicaid, which is the only reason my grandkids see a doctor, including my youngest who has ADHD, autism, and PTSD from surviving 2 floods in our area in the past 3 years.
It's important to tell these stories because they often get lost in the shuffle of really big numbers that can sometimes be hard to grasp. These Americans are why we're fighting for Medicaid. So if you're as pissed off as we are that Republicans are literally celebrating at the White House that they're screwing over Medicaid recipients, then there's something you can do. If you have less than 30 minutes, go to TrumpTax.com to learn about how Medicaid cuts are going to affect the state you live in. Arm yourself with the facts and let people know how Republicans are cutting healthcare to give tax handouts to billionaires. If you have more than 30 minutes, join our weekend of action this weekend by going to democrats.org/takeaction. Find an event near you and sign up to volunteer. And lastly, if Medicaid and healthcare are top issues for you, then find out how you can host your own event in your community. Again, you can go to democrats.org/takeaction to register your event, and one of our organizers will reach out and help you plan it. Together, we can protect Medicaid and Medicare as the essential programs that they are. So we hope to see you at the DNC's Weekend of Action. Thank you for joining us today for this episode of The Daily Blueprint. We'll be here right with you every day at 10 a.m. Eastern on the DNC's YouTube page. Until tomorrow.